Pip I'm a recent graduate of a Masters of Social Science.
I'm Sam Marshall. I'm also recently graduated from medicine. I'm working as a doctor up in Newcastle.
I'm here because of my interest in urban planning, how to make cities healthier.
From a medicine point of view, it's very insular. You only ever really connect with people's ideas that are in the same network. People just say buzzwords in meetings like engaging and all these things, and they never really act on it. I want to sort of cross that barrier of actually getting people involved.
Welcome to this great event, this wonderful boot camp here in Sydney. This is the third boot camp that Brendan and NCD have run.
We wanted to try and get people outside of the global health field to take an interest in NCDs and start a conversation. Do we universally agree that everyone, irrespective of where they're born, their socioeconomic position, should have the right to health, the right to receive medical treatments and essential medicines, and the right to have access to affordable, healthy and sustainable foods.
I am so excited there is a big group here. I always worry when you come to these kind of things that they're like people on a Friday night talking about NCDs, there'll be like 4 nerds, but there's like this big crowd of like cool looking people. This is great.
These were cigarette billboards. No one ever defaced anything in those days. And we went around late at night defacing billboards.
It was a cool night. It was like really informal, but yeah, everyone got to know each other. I was like, oh, quiz, yes, let's go. I'm going to smash this. We got 0 questions right.
That is not buzzing in. You gotta say things.
I believe cities have human capital, and you have such a sort of exciting capacity to solve problems and find new ways to make our life better.
Let's end non-communicable designs. Pieces of communication which just don't get through. Designs which suck. Messages which are true but don't really matter because nobody cares. Make it compelling when you communicate.
You need all sorts of people in a campaign, and sometimes the least likely person turns out to be the most useful.
I'm really interested in ideas that effectively just give people an excuse to talk to each other in an authentic way.
A little bit of information overload, but in a good way. I quite like that crazy is good. You can subvert the rules a little bit.
I'd love to help facilitate the Grow Local in Bankstown. I reckon food would be off the hook. And I think food is a great leveller.
In this room, it's actually some of the most powerful people in the world. If you're university educated in Australia and you speak English, you're probably the top 1 or 2% most influential people in the world.
I'm looking forward to the next part, which is our creative incubator. So we're getting into our groups, which should be really fun.
We're currently acting out our scenes to signify that prevention is actually better than a cure. So you can actually prevent all the diseases by making little life choices at the start.
Just been workshopping our idea before presenting it very soon, so not nervous.
A couple of them I thought could be turned straight into an ad. They were really, really funny and they got the message home really easy. It's quite funny sitting and reflecting on the whole day. Like, there's such different things and different themes that were tied together. Going back to the hospital, I've seen heaps of different things I can try and integrate.
To see people who are starting up their own organisations and running these amazing activities, it's really inspiring. It's an amazing network of people. Everyone's doing totally different things. It's a really diverse group of people.
Public health professionals, like landscape architects. For me, that's what this was. It was taking everyone from all these different walks of life that are passionate about different jobs and bringing them together.